Salford Clinical Commissioning Group, or CCG, is an NHS organisation made up of local GPs and other healthcare colleagues. The CCG decides how to spend the NHS budget on the majority of health services for 247,000 people living in Salford. This includes the care and treatment you receive in hospital, maternity services, community and mental health services. This film provides a snapshot of some of our work over the last 12 months. We launched the Salford Standard. The Salford Standard describes the level of care you should expect when you go to a GP practice in Salford. This is to make it easier to see your GP and for everyone in Salford to get the same level of service and care whichever GP practice they go to. For example, more ways to make appointments, pre-book appointments up to 4 weeks in advance, same-day appointments based on clinical need. In partnership with Wigan and Bolton, we are one of 7 maternity pioneers nationwide. This means we can lead the way in making sure we have the widest choice of personalised maternity services for women. This includes personalised maternity care budgets and moving the Salford Birth Centre into the community. We spent £1 million to help communities across Salford. More than 100 voluntary organisations, community groups and schools got money from our third sector fund, including Incredible Edibles Tyndall Street project. They are a social movement encouraging more Salford residents to grow food and needed to reach more volunteers. With partners, we launched one of the first integrated care organisations. Council and health staff now work together to deliver more personalised services for residents in a streamlined system to keep patients out of hospital and receive care closer to home. The CCG achieved the top rating in the CCG Assurance Framework for 2015-16. Combined with Salford Royal NHS Foundation Trust's previous outstanding rating from the Care Quality Commission, it makes Salford one of only 2 places in the country with a CCG and Acute Provider Trust to have the highest accolade. We are working with other public sector partners to address the devastating impact suicide has on families and communities. We want to make sure the right support is available at a time of personal crisis so people do not consider suicide as the answer to the problems they face. Our primary care workforce strategy is our plan to bring in more people to work in primary care and develop their skills. So far, we've funded 24 apprentices, 23 pharmacists based in GP practices, 12 new advanced practitioners, and 10 physician associates to support GPs. Our Innovation Fund is for testing new healthcare products, services and practices for the people of Salford. We invite funding applications throughout the year, including a digital health call to try out new digital technology. We agreed to fund the Guardian Angel project, helping Salford residents at risk of falls to live more safely in their own homes, Salford Active Walk, an app to get people walking more, Salford Citizen app, helping young people grow their self-confidence, self-esteem and mental well-being. We aim to put the voice of the patient and public at the heart of what we do. In 2016-17, we engaged with more than 5,000 Salford residents on a range of topics, including suicide prevention, mental health, integrated care, and maternity and community services. We worked with Odd Arts to create the drama workshop A Spiralling Mind. It visited all high schools in Salford, reaching over 2,300 young people to get them talking about mental health. For Dementia Awareness Week, Salford's Dementia Champions Group, users and carers, invited the members of the Dementia Providers Forum to co-produce a unique, innovative event. For the first time ever, Salford CCG worked with Salford University students and Keys News to live stream the event. This enabled patients, carers and relatives and anyone else who was unable to attend to take part virtually. Both received national recognition at the AHCM Awards, gaining Best Engagement 2016 and Commended Engagement 2016. Salford CCG and Salford City Council have formed a citizen advisory panel made up of 8 members of the public to help shape our citizen panel meetings and provide expert advice in relation to health and social care engagement. It's made up of Bert Shepherd, Anne Broadhurst, Sean Dempsey, Sue Fisher, David Backhouse, Jack Carter, Peter Bainbridge and Keith Johnson. Members all have specialist experience and skills in relation to seldom heard groups, for example learning difficulties, autism, people with long-term conditions and physical and sensory impairments. We had longer opening hours in Eccles. 3 GP practices continue to pilot longer opening hours and weekend appointments. This will continue throughout 2017 to 18 until the Salford-wide service is launched. With partners, we're working on an ambitious improvement programme to make Salford the safest health and social care system in the UK. This is just a snapshot of our work and our work with partners and the people of Salford over the last 12 months. We know we've much more to do and look forward to the next 12 months. For the full annual report, go to www.salfordccg.nhs.uk/publications. If you don't have access to the internet and would like a paper copy, please contact us on 0161 212 4800.